Hello and welcome everyone. Today I will be discussing about one more important topic in orthopedic surgery, which often comes in the mind of our patients who are planned to undergo any kind of hip surgery, that what is the difference between this total hip replacement and partial hip replacement. Understanding the difference between these two surgical procedures is very important for patients who are planned to undergo this kind of surgery, or patients who are suffering from any hip joint issues, either degenerative arthritis or injury around the hip joint. So to know about the difference about these two surgical procedures, it's very important to know about the basic anatomy of the hip joint. Hip joint is a hip and socket joint. This part is the socket. This is called the acetabulum, and this is called the femoral head. This femoral head is attached to the acetabulum and it rotates in the acetabulum to gives us mobility to do our day-to-day activity. Obviously, there are some other structures around the hip joint which gives us stability in the hip joint. So first, let's talk about the total hip replacement. So in this surgical procedure, it is also called the total hip arthroplasty. So what we do in the surgical procedure, we replace the acetabular part and the femoral head which is attached to the thigh bone. So both these parts are replaced in total hip replacement and replaced with a prosthetic component. So the basic indications for the patients of total hip arthroplasty is patients who are suffering from avascular necrosis of the femoral head, patients who are suffering from any degenerative arthritis, or in younger patients who have fractures around this hip joint. On the other hand, that is the partial hip replacement or hemiarthroplasty, only the femoral head is replaced and the acetabular part remains untouched. So this is a less invasive procedure and is indicated for patients who have injuries around the hip joint in elderly age group, and also for patients who have less severe kind of arthritis of the hip joint. One of the key considerations is that in both the cases where both the surgical procedures are done, post-op rehab is very important for these patients to give a better outcome. So as orthopedic surgeons, what we do, we assess the x-rays of this patient and we recommend this patient the procedure which will fit them according to their needs. So in summary, what I want to say, that to educate our patients about the procedures which is required and which they are going to undergo is very important for a better outcome for this kind of surgeries. Thank you.